Well, there are some major concerns surrounding Medicare, Medicaid, as that big tax package is being moved around Congress. They made some moves last night, as a matter of fact.
They sure did, and to move it forward. So the administrator of the Centers for Medicare and Medicaid Services, Dr. Oz, is here with us this morning.
So what do we call you now? Is it still Dr. Oz or
Director Oz?
Mr. Administrator?
You're my friend, so call me Mehmet.
Good to see you.
Good to see you,
God, I
Bill,
haven't
Mike.
seen you in a couple of years now.
Although the studio looks the same.
Oh, well, we're all the
It's
same.
great.
We don't advance, we don't move on. It's just us. So, why are you in Philly?
Well, I mean, I live in Philadelphia.
Right.
I just don't get to come home that often because we all had to move to D.C. because everyone has to work in the office now. But I was back home seeing. We had our grandson's birthday party over the weekend.
Awesome.
So it made it festive. But most of what I do is try to figure out how to take care of the most vulnerable. You ask me what to call me? That's what I do for a living. The official title is the administrator of CMS, which is Medicare, Medicaid, all the exchanges, CHIP, which is the kids program. But if you walk into the building where Bobby Kennedy and I reside, the Health and Human Services building, there's a quote up on the wall from Hubert Humphrey. The building's named after him, and it says, it's a moral obligation of government to take care of those at the dawn of their life. Those are the babies, like my grandson. Those are the twilight and zenith of their life, at the very end, the seniors. And then those who are living in the shadows. And when you go to Kensington, which I'm going to do later today, and you travel around to some of these centers for older folks, you begin to see people who are struggling. And the question for us as a nation, this is a bipartisan issue, is how do you take care of the most vulnerable?
Well, you certainly don't cut Medicare and Medicaid then.
By
the way, I need it. Please, Dr. Oz, do not take this away from me.
Mike,
I mean, you talk about Hubert Humphrey.
Yeah.
That was, what, the mid-'60s when LBJ,
Yeah.
created Medicare and Medicaid and stuff like that. Well, don't take it away from me.
There is no program that I've seen where you actually reduce spending on Medicaid. Medicaid spending has gone up 50% in the last 5 years, and it continues to accelerate at a rate that's far beyond what the economy
I
grows
thought this
at.
was part of the tax package they're talking
No.
about in D.C.
They're slowing down.
We need to cut Medicare and Medicaid.
No, there's that word. Those words will never come out of anyone's mouth who's actually involved with the bill, because what they're trying to do is reduce the increased growth in spending. If the economy is growing, let's just say, at 3% a year, and Medicaid is growing at 7% or 8% a year, it grows so much faster than the economy that it begins to now suffocate the system. And most importantly, those vulnerable populations I spoke about, there's a certain number of doctors and hospitals who will take care of those folks. If you dramatically expand Medicaid and you don't provide some type of a work requirement, which means, by the way, either you try to get a job or try to help in your family or try to get an education, volunteer, do something of service to the community, then you start to bulge the system so much that there's not enough people to take care of the folks who need.
So you're not going to add to it, but are you telling me right now that you will not cut Medicaid?
We will not cut Medicaid.
Or even some...
Medicare is not even on this. Medicare is not even being discussed. Medicare is not being touched at all.
But even with Medicaid, the Congressional Budget Office released some figures, and they're saying based on where it is now, 7.6 million Americans will lose health insurance over the 10 years. So if we're not making cuts, some people still might lose their coverage that they do need. And that's a nonpartisan...
Agreed. But Alex, let's do a thought experiment. You have a relative in your home who is getting free health insurance, and you say to them, in order to keep getting the free health insurance, all you have to do is apply for a job. Even if you don't get it, apply for a job, volunteer somewhere, try to get yourself educated, sign up for school or something, or you've got someone at home you got to take care of, right? As long as you have those things happening, you get to keep your free Medicaid. If you're not willing to do even that, what would you tell that relative? That's what we're discussing in America today. We have got to get back to where we were even 5 years ago with these programs, where we actually had a sustainable system. My job is to save and protect Medicaid. That's what I'm seeking to do.
Yeah, you're not asking 70 and 80-year-olds to go get a job.
No, this is for Medicaid.
Okay, Medicaid.
Medicare population is fine. If you're over the age of 65 or have other conditions, we're not touching Medicare. The president has promised they will love and cherish Medicare. That's not at all being discussed. That program, actually, with a couple of tweaks here and there, I feel pretty good about it.
But what about the copays? Because if we're talking about Medicaid and folks who already are dealing with a lot and they're low income, we're seeing reports that it may be up to $35 now, new copays that weren't there before.
The copays for most people in America are under $10 a month. And please, if you're listening to me right now, currently.
But with this, they're saying it could go up to 35.
I've seen some theoretical ideas here and there, but I'm just telling you what the reality is right now. But we can't get people to sign up. Alex, You know, if I gave you free insurance, basically, right? It's $10 a month, $10, and it can be zero, by the way, in some situations, and you get to choose what plan you want, and you don't sign up, then that's a problem. So we believe there are a lot of folks who actually could get the exchange insurance, the insurance that was created by President Obama. It's there, but people don't take advantage of it. The administration of CMS spent $250 million last year advertising to get people to sign up for something that doesn't cost really anything, but there's a disconnect. People don't trust the system.
Well, you mentioned the Affordable Care Act, known as Obamacare, which enhanced, I think, Medicaid a little bit. Do you want to get rid of that?
No, that's not being discussed at all. The Affordable Care Act, the exchanges.
Do you like the Affordable Care Act?
I think it's a very effective way of getting people off Medicaid who want to work into the workforce. The goal here is very simple. We, as a population, every great country takes care of its most vulnerable. We're great people. We're going to do that. So if you're having trouble, young, old, pregnant, without much money, a medical illness, you're going to get Medicaid. As you start to work and get into the workforce, to get educated, do something to volunteer, you start to move into the exchanges, where now, because you're doing some work, you get a different kind of health insurance. And then from there, you get into the regular insurance that we all probably have from the jobs you've been working. That's how it's supposed to work. If you infantilize people, you tell them, you know what, don't bother doing anything for yourself. We're just going to throw the money at you. You eventually bloat the system so you can't take care of the people it was designed for. You mentioned 1965, Hubert Humphrey, LBJ. Medicaid was, when it was created back then, took care of less than 10 million people. It swelled up to 90 million people during the peak of COVID. Now it's about 80 million people, Medicaid and the CHIP. That's a huge difference. You're now offering it to a very different population, able-bodied people, if they can go to work, if they have the ability to volunteer, go to school, or take care of family, they should.
Well, they can be able-bodied, but you know who doesn't need Medicaid? Rich people.
No. But they don't get Medicaid.
They don't get Medicaid.
Yeah. The other thing, can I touch on one last topic? Because I got your attention. It's hard to get his attention, Alex.
Tell me about it.
But the fraud, waste, and abuse. This is something that is also clearly a bipartisan need. We have not policed the system well. And so because of that, for example, we have many people who are enrolled in Medicaid in multiple states. We actually have people who are enrolled in Medicaid and in the exchanges we talked about.
Are you going to go to this thing where so many people, dead people, are still on the roll?
They're still on. Well, that's true, too. That's not what the big problem is, though. That's not the big problem. The big problem is you're in Pennsylvania, you get Medicaid here, then you move to Jersey, you get Medicaid there, and which state is actually your Medicaid provider? And the government, federal government, pays for both. That's $1 billion a year between that and the exchanges duplication. Those are the kinds of things we can do a better job on. And also, we don't want Medicaid paying for, housekeeping expenses. We don't want them paying child care expenses. Medicaid is for health expenses for people who desperately need it, again, the vulnerable.
Well,
if you expand it beyond that, you cause problems.
Cut that fat out.
Oh, I like that.
Cut the fat.
Yeah. Cut the fat, not Medicaid.
You better not be taking my Medicaid away.
I'm not.
Just real quickly here. Don't you miss TV? Why did you get involved in the Trump administration?
This is the best job I've ever had. You work with incredibly smart people, a very clear passion for service. Again, at Medicare and Medicaid, you are very much mission-oriented. Everyone that I run into gave up a lot to come into the administration, as I did, but others as well, in order to serve the American people, because you realize this is a crisis point, and it is a generational opportunity, Mike and Alex. We have people coming in who you'd never normally think about going into government, myself included.
Boy, that's for sure.
But these folks are doing everything they can to save systems that we grew up with, because they see this country as a shining city on the hill that the rest of the world looks to for leadership. And if we don't take care of our own, we can't lead the rest of the world.
There's a lot of former TV people in the Trump administration. I've been on TV most of my life.
You want a job?
He wants next, yes.
Oh, I like this. Perfect. I'm going to put you in maybe transportation. What do you think?
No, I want interior.
Interior.
Because I've spent a lot of time inside.
There you have it.
See that logic?
He'll be here all week, by the way.
Where are you headed now?
So our regional office in Philadelphia, which is fantastic, is in the city. So it's just a few blocks from here. So take a stroll down Market, and I'm visiting Kensington today.
Yeah.
Just this is the largest open-air drug market in the country.
I remember those pieces that you did on your show.
But I was in medical school here in West Philly. Kensington was not like this at all, and that's changed dramatically. I'm going to visit a PACE center. Do you know what that is? Where it's a program for caring for older folks.
Yes.
The idea is to keep them out of nursing homes by providing community to them. This is how you do healthcare right. Do what human society's always done. Embrace older folks, love them, cherish them, make sure that they feel connected to the community. Those were the blue zones come out.
I remember, yeah.
Places where people live 4 years longer than they do.
That's right.
In the 4 times longer to age 100 than they do in the
We
U.S.
have one of them in the U.S.
Yes, we do. Loma Linda. Nice
Linda.
job. Yes.
Yeah, Loma
But
Linda.
Sardinia, Costa Rica, what do they do in common? The older folks get together, they're revered, and they talk and
Dr.
connect.
Oz,
There's
you've been in
community.
television. You've worked in television. We're getting rap.
They're rasping
Oh,
us.
I'm not. I don't have it.
He doesn't have an earpiece in,
I don't
so he
have
doesn't.
it. Rap.
There we go. Yeah, they're telling us. So we're going to
Mike,
take a
take
break.
care. Alex, take
Thank
care.